With research results like this, John Money came to believe that gender was susceptible to change, and that upbringing played a significant role in developing a female or male identity. The team at Johns Hopkins expanded their theory to include the notion that gender was malleable in all children, not just intersex children. And eventually they came to understand there was a critical period during the first 2 years of life when this could happen.
The theory that had emerged at Hopkins was that you were really neutral at birth. You were neither male or female, and how your environment determined whether you were a boy or a girl.
To put in a nutshell, since we're saying that early time, was that yes, there are a lot of biological factors to be considered, but when all is said and done, the most important one is how the individual is reared. So to make it simplistic, if you put a child in a blue room, it'll become a boy, and if you put it in a pink room, it'll be a girl.
In the 1950s, this notion of gender neutrality at birth was not a particularly radical idea. The power of nurture was already well understood, especially among mothers. Child behavior specialists like Dr. Spock convinced parents that they held the key to their child's future happiness. So when John Money suggested that an infant's gender could be changed through upbringing, people listened and believed.
Money's ideas dovetailed with a lot of ideas that were being produced in the period. So in the context of the 1950s, his ideas were not crackers. They were not insane. They were pretty good scientific ideas.
Many doctors also embraced John Money's ideas because they offered solutions. Physicians treating intersex boys could now feel more confident changing them into girls.
It allowed me as a surgeon to be able to deal with parents of a child who was a genetic male but had no penis and feel comfortable in saying we have a surgical solution because we have a psychological solution, and that surgical solution is going to coincide with a psychological solution. We can rear the child as a female, we can construct the child as a female, and your child will grow up and be a successful, happy girl or woman.
Boys born with small or ambiguous genitals were often surgically changed into girls.
In this field, sex assignment as a girl has been deemed necessary if the penis was below a certain critical size. The argument was that the penis had to be large enough for a little boy to pee standing up, and if it wasn't, then the recommendation was to assign the child as a female, to remove the penis, fashion a clitoris out of some of the penile material to create an artificial vagina.
By the mid-1960s, surgeries like this had been performed on intersex infants. But this procedure had never been attempted on a child born with normal genitalia. This was not clear to Janet Reimer when she brought her infant son in to meet with John Money.
I asked him at the time if this had been done before, and he said yes, it had been successful. He did not say it was an experiment. We were not told that it was the first one.
On July 3, 1967, Bruce Reimer had his testicles removed and the beginnings of a vagina surgically created. He was almost 2 years old. From now on, Bruce would be Brenda. She would be raised as a girl, treated as a girl, encouraged to behave as a girl. She would receive psychological support, and at puberty she would be given female hormones. The plan was that with this combination of treatments, Brenda would grow up not only to look like a woman, but to think like a woman as well. In the 1960s, as the idea of nurture's dominance over nature gained popularity, critics began to emerge. Among the most vocal was University of Hawaii professor Milton Diamond. He did not agree that a child's gender could be altered through upbringing.
My immediate reaction to the thesis was it was simplistic. I thought humans were a lot more complicated than just being a product of their upbringing.
Milton Diamond is a biologist. He believes that just as animals are born with instincts to behave like males or females, so are humans.
I saw no reason for humans to be that different. Certainly we're influenced by our society. Certainly we're influenced by our learnings. But our basic inclinations, the basic framework or predispositions we have to come from biology.
Using the powerful hormone testosterone, Diamond took a series of animal experiments designed to show the influences of this hormone in the womb. Pregnant rats were injected with testosterone, which found its way through the umbilical cord into the baby's bloodstream. When they were born, the females in the litter had genitalia that looked almost male. The artificial surge of testosterone had transformed their bodies. But the big question was, would these masculine-looking females also behave like males? The answer was yes. The females who had received the hormone in utero even attempted to mate as if they were male. It appeared that testosterone had reprogrammed their brains, giving them the instincts and behavior of males.
So in other words, here's an intervention during their embryonic life which affected their adult life. So those type of experiments showed, at least for animals, that this was possible.
But what affects animals does not necessarily affect humans. To prove that testosterone in the womb could also change a child's gender identity, Diamond would need far more evidence. So when he attacked John Money's theories, few people listened.
My view was a minority view because the Hopkins group had a great status, and my ideas were relatively out of the ordinary.
First discovered in the earlier part of this century.
John Money's theories about gender helped determine the treatment of hundreds of infants each year.